SDEC, as the name suggests, is the same-day emergency care. It's the care given on the same day for emergency patients who would have otherwise been admitted into a hospital. Because we rapidly assess, treat and diagnose on the same day, the patient is safe enough to go home instead of being admitted to a ward. The principle of SDEC is very much in line with the NHS vision of the right care at the right place at the right time. The principle again behind it is that traditionally we used to be admitting all emergency patients with emergency conditions, but we have figured out that some conditions do not need admission into hospital. And the problem with hospital admissions is there's a risk of infections, long stay we know have poorer outcomes, and hence we try to get the patient home on the same day. So by doing that, we actually free up the hospital's capacity for real conditions that need admission, whereas the patient can be treated, assessed and sent home the same day with follow-up. Patient can be referred either from the ambulance by a paramedic, from the GP services, primary care, community, can be through 111, or if they do end up in the emergency department, they will be triaged, a process by which we understand what condition they have, and if they have that right condition, we send them to the same-day emergency care. Proposed opening hours for the new SDEC is actually 24/7, but to begin with, when we begin in August 2022, it will begin at 7:30 a.m. up to midnight. The new same-day emergency care is due to open in August 2022. However, we do have the temporary modular build, which functions as the medical same-day emergency care in progress now. They are seeing patients. Similarly, work is being done in the surgical same-day emergency care, so patients are being seen there as well. SDEC is very good for patients because of the patient experience. You would come into a service, you've been seen right away, assessed, diagnosed, treated and sent home the same day. You do not need to be admitted into a hospital unless absolutely required. Apart from that, you must understand that hospital admissions prolong risk to infections and have a lot of problems which come with it. So unless it's absolutely required, the patient can go home the same day. It's a beautiful experience for the patient. We are all aware of the pressures the hospitals are under currently in terms of capacity. Hospital admissions are always full. So it is really vital that we have patients who only require to be in hospitals to be admitted. All other patients can be assessed, treated and sent home the same day with follow-up, so it is safe to send the patients home. We're only picking patients who are stable, who have the condition which is able to be sent to the same-day emergency care. So it is both safe, good for the patient as well as for the hospital. Needless to say, there is a financial and cost benefit to it as well. So the same-day emergency care is part of the emergency village, and as you know, the emergency village's vision is the specialist to the patient rather the patient to the specialist. Hence, this will be a multidisciplinary team of all specialists, including medical and surgical specialties. Working in a multidisciplinary team can be really exciting and good opportunity for learning. It will create an environment of camaraderie and learning, cross-learning from each specialties. In fact, it's a very good experience. A lot of people have expressed their desire to work in such an environment. Of course, SDEC is a new concept, a new way of working, new way of thinking, but it also has, develops new relationships. So all in all, challenging but really good.